Hi and Assalamualaikum everyone. We are here to share an interesting topic which is brief of life, understanding asthma. Before that, I am Idayu and my group mates consist of Shukrina, Fitri, Haikal and Amni Hazik. Alright, not to waste any more time, let's begin our discussion. Asthma, which specifically called bronchial asthma, is a chronic lung disease affecting people of all ages. It is caused by inflammation and muscle tightening around the airways, which makes it harder to breathe. Asthma symptoms can be triggered by different things for different people. Allergens like dust or pet tenders are common triggers. Some people also develop asthma symptoms in response to certain foods or to exercise. Asthma can be deadly. Currently, there is no cure for asthma, but appropriate treatment prevents asthma attacks and can help patients have a better quality of life. One of the earliest mention of asthma is respiratory distress and wheezing, which is the occurrence of a whistling sound while breathing that has been found in 2600 BC in China. According to the National Health Interview Survey in 2021, United States, females have higher percentages of people with current asthma, which is 8.9% compared to males, which is only 6.5%. So, why do males and females have different rates of asthma? Some studies suggest this trend because of the effects of testosterone on lung cells. Testosterone, a male sex hormone, has been found to decrease the swelling of the airways in asthma.
Next, we move to the symptom of asthma. Basically, symptom of asthma can vary from person to person. Sometimes, it also get significantly worse than known as an asthma attack. Asthma often worse at night or during exercise. So, here is the common symptom of asthma. First, shortness of breath. Second, cough or wheezing attack that are worse by a respiratory virus such as cold and flu. Other than that, most of people experience asthma will tend to have chest tightness or pain. Lastly, common sign of asthma in children is wheezing when exhaling and sometimes when inhaling. So basically, I can say that some people will have worse symptoms when they have a cold or during changes in the weather. Other things that can trigger asthma include dust, smoke, fumes, grass and tree pollen, also strong soap and perfume. It also can be caused by other conditions as well. However, people with this symptom should talk to a healthcare provider.
We still continue to explore what causes asthma, but we do not know these factors play an important role to the development of asthma. First, what causes asthma? Family history. If you have a parent with asthma, you are 3 to 6 times more likely to develop asthma than someone who does not have a parent with that disease. Secondly, allergies. Some people are more likely to develop allergies than others, especially if one of their parents has allergies. Certain allergic conditions such as eczema and hay fever are linked to people who get asthma. Thirdly, cigarette smoke irritates the airways. Smokers have a risk of asthma. Those who smoke during pregnancy or who were exposed to secondhand smoke are also more likely to have asthma. Fourthly, exposure to the main component of ozone raises the risk for asthma also. Those who grew up or live in urban areas have a higher risk for asthma because of their proximity to the factories that release these smokes. Lastly, obesity. Children and adults who are overweight or obese are at a greater risk of asthma. Although the reasons are unclear, some experts point to low-grade inflammation in the body that occurs with the extra weight. Obese patients often use more medications, suffer worse symptoms, and are less able to control their asthma than patients in a healthy weight range. While these factors increase a person's risk for developing disease, there are additional factors such as poverty and a lack of health insurance that contribute to more asthma symptoms and must be avoided at all costs.
For precaution to prevent asthma attack, first, the patient need to identify their asthma trigger. So these some of them are peanut and seafood. So the patient needs to know their asthma trigger so they know what measures can be taken in this situation. Second, they need to prevent colds. In cold temperature, it will disturb their respiratory system, which may lead to wheezing and short breath. Third, they need to stay away from allergens. Some of them are seafood and peanut, also the same as asthma triggers. So they will trigger asthma attack when you are near allergens or you consume these allergens. Fourth, they need to avoid smoke of any type. Smoking is the one of the biggest mistake for the asthma patient to do, which is the same as allergens. It will lead to short breath. Last but not least, the asthma patient need to take asthma medication as prescribed. They need to take their medication as told and do not overdose.
There are few treatments for asthma patients. Asthma patients often use inhalers, including reliever, preventer, and combination type of inhaler as part of their treatment. Some may require nebulizer treatment to manage their symptoms effectively. Others may benefit from medications like leukotriene receptor antagonist (LTRA) or theophylline to control their asthma. In severe cases, steroid tablets or injections such as biologic therapies may be necessary for immediate relief during an asthma attack. Surgery such as bronchial thermoplastic treatment might be considered for those with severe asthma complications. Complementary therapies like breathing exercise such as the Passwords or Bertaker method can also aid in asthma management. Some patients may explore alternative treatment such as ionizers or chiropractic homeopathy, although their effectiveness may vary. That's all from us. Thank you.